thanks everyone for joining us on our first webinar, where we're going to chat you through some of the latest updates in laminitis. I think it's important to note that it's an area that's rapidly evolving. There's a lot of new information out there, and to help us break down some of that new research into information that might be useful for you guys in treating and managing your laminitic horses and ponies, we've got a medicine specialist all the way from the UK. This is Dave Rendle joining us. Some of my clients will probably be familiar with Dave with his consultancy work on their cases. But for those of you that don't know him, Dave's a RCVS and European specialist in equine internal medicine. And probably over the last decade or so, you've published a lot of work in the field of laminitis, right, Dave? So thank you for joining us today. Really appreciate it.
My pleasure. Thank you. Thank you for asking me.
No worries. So I think we should probably jump right in because we've got a lot of stuff to cover. Did you want to sort of talk through what is laminitis, and we'll just break it down, so give everyone a good base?
Yeah, no worries. So itis just means inflammation. The laminae are the layers within the hoof that hold the wall of the hoof to the pedal bone, or more accurately, the other way around. They support the pedal bone and hold the pedal bone within the hoof capsule. So laminitis is just inflammation of those structures that are connecting the pedal bone and the hoof wall. And the laminae are really clever. They're a bit like Velcro. They've got all these little interdigitating structures that allow the hoof to grow and expand while still allowing the wall and the bone to remain really firmly fixed. So yeah, it's a phenomenally clever structure. When that gets inflamed, we get an accumulation of inflammatory products and fluid between the two layers of the laminae, and that starts to force those layers apart, and that structural integrity starts to break down, and that Velcro starts to peel apart. And as that happens, obviously the weight of the horse is bearing down on all 4 feet, and the forces that are going down through the horse's legs and into its feet push the pedal bone away from the hoof wall, and the two structures start to separate. So you've literally got tearing of the bone in the foot away from the wall of the foot. So it's a bit like ripping your own fingernail out with a few hundred kilos of weight on top doing it. So it's a really hideous process. It's a really painful process. It's a huge welfare issue. I don't think people appreciate quite how much pain these horses are in, because horses are stoic animals, they're prey animals. They don't show pain. That's obviously a sign of weakness, the predators. So they suffer in silence. Yeah, it's a huge problem, laminitis. Once the structural changes start to develop, it can be hard to reverse them. I'm sure Tanya will come on to the clinical signs and the need for prompt treatment, but it really is imperative that people are picking up on the subtle signs of laminitis early to avoid unnecessary suffering. Maybe it's just worth talking through those radiographs as well that you've got on there, those x-rays, Tanya. You can see the two nice pictures you've got there. The top one shows a pretty normal horse's hoof. There's a bright white line down the front of the hoof wall, which is just a marker to show where the hoof wall is. And you can see that the bone and that line are pretty parallel, which is how they should be. The bottom radiograph, where you put some red arrows on, you can see the pedal bone is pulling away from the hoof wall. And you can also see a black line between the pedal bone and the hoof wall, which just shows an area of gas where the two laminar layers are completely ripped apart. So the fingernail is effectively being ripped away, allowing the pedal bone to move. And that's why we talk about rotation and we talk about sinking, because that pedal bone is not fixed within the hoof capsule and it starts to move. It then starts to press on the bottom of the sole, which causes bruising and necrosis and further pain. So it's a really hideous condition.
Yeah, and I think if we look at the little video of that little pony, which I saw only a couple of months ago, he's found it in all 4 feet, and you can see he's just, standing there, he's not quite sure where to put weight on, and he's just obviously in a lot of pain. So I think it's also important, as Dave said, that there's a range of clinical signs that can occur, and, like horses being prey animals, as we've already said, they're pretty unlikely to show overt signs of pain until things get really, really bad. So one of the things we really want to stress on this webinar is that laminitis is an emergency, and get you guys to recognise some of the early signs So we can pick this up and hopefully prevent any sort of unnecessary suffering in your horses. When we're talking about some severe signs, like we've got that pony that I just showed you the video of, we've also got this little grey mare who's, as you can see, by the time they get like this, they're in a lot of pain. She can barely put any weight on all 4 feet, and she's obviously in excruciating amount of pain just walking 2 to 3 steps. But one thing that you guys can do is sometimes these horses will just present with, mild increase in digital pulses. And you might notice that they're a little bit painful when you're walking on sort of firm ground, or they're a little bit short stepping when they turn. And one of the things that, upsets me a little bit when I see these things is a lot of owners often tell me that, oh, he's always a little bit sore at this time of year, or he's always a little bit sore to turn. Well, really, these horses are always laminitic at this time of year, and they're always in a lot of pain. So it's important to realise that it is a spectrum of clinical signs. And just because you're only seeing the mild signs doesn't make it any less of an emergency. And you really need to get your vet involved sort of early in the disease process. So in order to prevent any of these irreversible changes from happening. Would you agree with that, Dave?
Yeah, 100%. Laminitis has become quite common in certain populations, and people therefore trivialise it, consider it normal, which is a complete affront to equine welfare. Oh, my horse is a bit footy. He always gets a bit of lammy at this time of year. It's just a hideous condition, and it's quite distressing that people consider it acceptable for horses to have chronic recurrent laminitis.
Yeah. So if we're going to jump into talking about, give people a brief overview, there's a few different types of laminitis, and I think it's really important to separate the 3 different types. We're obviously going to focus on one type in particular because that's the most common type of laminitis we see in practice. But to give the people that are watching a bit of a brief overview of other types.
So it's really rare for us to get inflammatory laminitis. So if horses get really sick with diarrhea or pneumonia or retained fetal membranes, or possibly they overdose on a huge amount of grain and become really toxic, if they get really sick, then that can cause inflammatory changes in their feet and they can get laminitis that way. It's rare for that to happen. They can also get damage to the laminae if they're completely non-weight bearing on one foot and they have to put all their weight on the other foot, be it in front or behind, usually in front. So that's supporting limb laminitis, and that happens because there's so much weight all on the one foot that the blood supply starts to struggle and the laminae starts to become damaged. The end chain of events is similar, but those cases of laminitis are quite rare. The cases of laminitis that we see week in, week out, day in, day out, that are largely avoidable, which is quite distressing really because it's unnecessary suffering. The cases we see all the time are the endocrinopathic or hormonal laminitis cases. And the vast majority of those are caused by obesity, which causes metabolic changes that ultimately lead to damage in the feet.
I think one thing we also need to probably dig in a little bit deeper is talking about the role of insulin in endocrinopathic and hormonal laminitis, and how that occurs and how that might be different between one horse and another. Do you want to chat through that? Yeah,
so most of this work actually has been done in Australia, largely at the University of Queensland. Some really great studies that were done there, and they really helped to focus our minds on the fact that it's high insulin levels that are the link between metabolic disease and laminitis. So insulin obviously is a really important molecule that we all rely on, but horses with metabolic disease have much, much higher levels of insulin than they should have, and that insulin damages the laminae. We don't know exactly how that happens, but there are various different mechanisms whereby insulin could lead to that damage. We all think of insulin as being a molecule that controls sugar levels in the blood, but it does a whole lot more than that. It has roles in inflammation. It has roles in the degree of dilation of blood vessels. So there are lots of credible reasons why insulin can cause damage to the feet. And there's now irrefutable evidence that it is high levels of insulin that do lead to laminitis. Insulin gets high primarily in horses that are fat because their metabolism or they're obese. They're not always obviously externally fat, although the majority are. There are some obese horses that don't have huge external fat deposits, but have increased internal fat deposits. So they're still carrying extra fat, which is damaging their metabolism. That's the definition of obesity. So it's excess adipose tissue and excessively active adipose tissue that releases a lot of molecules that cause a resistance to insulin. And because of that resistance to insulin, the pancreas has to produce more insulin because the insulin's not working as well as it should. Therefore, there's more and more insulin circulating in the bloodstream. That insulin's going around to the feet. And one of the unintended consequences of this high level of insulin is the damage that occurs in the horse's feet. Also coupled with the fact that these obese horses also weigh more, so there's more forces going through the horse's feet, and that leads to laminar damage. Different types of horses will have a different tendency towards developing insulin resistance, and it tends to be the native or the UK native types, of which you guys have got many in Australia. So little Welsh ponies, Shetland ponies, cobs, those more cold-blooded types that have evolved to live on more thrifty pastures. They have an inherent tendency towards insulin resistance, and therefore the development of hyperinsulinemia, and therefore they're far more likely to get laminitis. The thoroughbreds, the Arabs, the standard breds that have been selectively bred have a different metabolism, and they're less likely to get laminitis. That's not to say they won't. They will if they're managed inappropriately, but they're at less risk.
Yeah, and I think we look at the picture that we've got down there. You see a typical scenario of an old thoroughbred who's got a little Welsh pony as a companion, and both of them are out grazing the same pasture, and the thoroughbred's fine, but the little Welshie, if we look at the graph on the side there, his insulin levels are quite normal, and hers go through the roof when they're grazing the same pasture. And it's really the individual horse's response to the diet that's really important, and that's what causes that difference in insulin secretion. So we got a lot of questions that were submitted leading up to this webinar, and I think it's important for us to tease out some of these differences too in terms of the role of PPID in laminitis versus EMS and laminitis. A lot of people wanted to know, was there a link? If they get EMS, are they more likely to have PPID? Do they have to have both conditions in order to get laminitis? So lots of questions there, and I'll leave that to you to tease out and explain.
I can do my best. We don't have the answers to all those questions, but I think we haven't really said what EMS is. EMS is equine metabolic syndrome, which is a pretty fancy way of saying obesity and insulin resistance. So it describes that syndrome of obesity leading into laminitis. And a huge proportion of our native types have equine metabolic syndrome. They're obese and they're at risk of laminitis. And that is the far and away the biggest cause of laminitis. The significance of PPID, I think, is still debated. I don't think there's any doubt it is an issue. We don't really understand quite how PPID leads to hyperinsulinemia and laminitis, and there are lots of PPID horses that don't get laminitis. So we do need to improve our understanding of PPID, but it's long been recognized that PPID horses are at risk of laminitis. Some of that may be because they also have equine metabolic syndrome, but they absolutely don't need to have both conditions to get laminitis. If they've got either condition, you need to be really on your guard about laminitis. And you don't need to give them the term equine metabolic syndrome to be worried about laminitis. If they're carrying excessive amounts of fat and they are one of those high risk types, you need to be thinking about the risk of laminitis. You asked if EMS leads on to PPID. That's debated. There are reasons why equine metabolic syndrome would lead horses to be more susceptible to getting PPID in older life, because being overweight for a long period of time does cause metabolic changes, does cause a pro-inflammatory state, which potentially could damage the nerves that are affected in PPID. So there are reasons why the two might be linked. At the end of the day, being fat is not healthy. So the more we can do to improve the body weight of our horses, the more healthy they're going to be, whether or not that leads on to PPID.
Have there been any studies following any of these horses through that have equine metabolic syndrome to see if they develop PPID, or hasn't really?
No, not the kind of studies we need to demonstrate whether or not there's a link, unfortunately.
Okay, so I guess diagnosing laminitis is pretty straightforward in terms of, based on the clinical signs. We can have x-rays, if we showed in that early on in the presentation. You can see, typical changes that occur radiographically in horses that do have laminitis. But one of the things that I think is really important is checking their insulin levels and checking what their insulin levels are doing in response to their normal diet. I know there's a lot of different tests out there that we can use that have been recommended that are sort of more standardized, so to speak. But what I tend to do is sort of check their insulin levels 90 minutes or so after they've been fed their normal diet to see how appropriate that diet is and how appropriate their insulin response is. What do you think of, in terms of testing wise, there one test better than the other, or they both all show different things?
No, I think there's pros and cons of different ways of testing depending on the scenario you're in. I think your approach is really pragmatic, really sensible in giving owners an indication of how at risk their horses are of laminitis. So yeah, that's totally fine. The most important thing I think is to be looking at that risk and assessing that risk, so that people can take the right action to prevent laminitis developing. In some cases, you might not need to test insulin if the horse is obviously overweight and needs to diet. You know it's at risk of laminitis without testing insulin, but doing that testing can help you to quantify the risk. It can help persuade owners that might be a little bit reluctant to accept their horses at risk of laminitis that it is at risk of laminitis. So no, I think there are pros and cons of different ways of doing it, but the important thing is to be proactive in investigating the risk and doing something about it.
I find it quite useful in measuring their insulin concentrations in terms of using that as a monitoring tool, in terms of how well the dietary changes are working. And I have a lot of clients who are very proactive, and they will measure their horses' insulins after they've been out grazing for 4 hours versus 6 hours versus all day. So they really know when is a safe, quote unquote, safe time to have their horses turned out to pasture. So in terms of a monitoring tool for management, I find measuring their insulins gives owners a really, really good picture of how to manage their horses individually.
I totally agree with all that. So it sounds like you've got some fantastic motivated owners. You've got to bear in mind that changes in weather, changes in season, changes in pasture will all affect the horse's insulin response. If there's a lot more sugar in the diet, insulin will get up higher. So there are lots of variables to consider. But as long as you're factoring those in, that approach of assessing risk is brilliant.
Okay, so now if any of you guys are unfortunate enough to experience laminitis, I think it's important for us to talk through some of the first aid and what you might want to do. We've already said it's an emergency and you should get your vet involved as soon as possible, for a number of reasons. But the first point that I want to bring up is confining these horses. I know there's a lot of information out there. It's a little bit worrying because there's a lot of conflicting information where some people talk about walking these horses, and just don't do that. I think, Dave, you probably agree that that's only going to result in more damage to an already inflamed and painful and unstable lamellae, and walking them is going to be lead to a world of trouble.
Yeah, 100%. It's just when these lamellae are damaged, they're partially separated or fully separated, you're only going to do more damage to them if you put forces through them and make the situation far worse, increase the horse's level of suffering, increase the time it's going to take to recover, or potentially prevent the horse from recovering at all. So yeah, complete no. I don't know, the best analogy is probably having your fingernail half ripped out and asking if someone would like to wiggle it around for you. Crazy, don't do it.
So obviously these horses are going to need pain relief, and your vets are going to be the best people to advise you on that. We tend to monitor these patients very closely because it's not a one-size-fits-all approach. Some of them might be quite comfortable on bute, whereas others might need other medications too to help control their degree of pain. So it's really important that, you know, they're monitored closely, especially in the initial stages, to keep them as comfortable as possible, but also not too comfortable that they move around too much. That's something it's a fine line that we want to try to balance. Taking them off pasture is really important. We already went through the insulin response to being on, you know, lush green feed. So off all pasture, I tend to lock them up in, you know, a small 3x3 or 6 metre by 6 metre deep sand yard, just to give them some foot support there. People tend to, you know, they recognise that their horses are in a lot of pain and they want to do something about it. But it's really important that you don't suddenly starve these ponies or these fat horses. That can lead to a whole lot of other issues. So providing them with, you know, good quality roughage that's low in sugar, give them a ration balance, a pellet too. We tend to like high gain zero in terms of what I recommend people. That seems to work well and it's easily accessible. Frog support's getting your farrier involved early in the stage of the condition can be really useful. They've got all sorts of different frog supports that might help one horse but may not help another. So there's going to be a degree of trial and error. So if something's not working, then you can certainly look at a number of different options out there. Icing the feet as well. Is that something you recommend, Dave?
I think the challenge with that, there's no doubt it works. Again, really good work that came out of the University of Queensland some years ago. The challenge is getting it done in time. In experimental studies where it's been done, it's used in the run-up to laminitis, when laminitis has been deliberately induced. In the field, we don't know about laminitis normally until it's happened. So we're often too late, really. It's not to say we don't do it. Yeah, it's challenging also to get enough ice on and keep enough ice on to have an effect. So yeah, I think it's tricky in practice, but there can be some value to doing it. I don't know. Is it something you do?
Early, very, like you said, very, very early in the disease process. It is challenging to actually keep the ice on these guys, but one of my clients there, you can see in that picture there, she's come up with this great idea. They've got these thing called dry bags from the local camping store, and they fit around a horse's foot perfectly. They're waterproof. You can fill them up with a sort of an ice slurry and tape them to their legs, and they sort of paddle around with these ice water slurry around their feet. And anecdotally, from what people tell me, it seems to make them quite a lot more comfortable when they're being iced. So I don't think it's going to do any harm. And if anything, it's going to have some benefit, right?
Yeah. It's just a challenge. It's hard enough in the UK, let alone WA.
Okay, so once we've got these guys past the acute phase and we've got them reasonably comfortable, I think it's really important to look at their diet long term, in terms of, you know, we said a lot of these horses are quite overweight, so we want to induce some sort of weight loss in a safe way. And it sounds a little bit prescriptive, but it helps when someone gives you some values about how to feed your horse and how much to feed your horse. But we really want you to restrict the amount of food they're getting. So you want to feed them approximately 1.5% of their body weight. For a 300 kilo pony, that equates to about 4.5 kilos of hay per day. For a 600 kilo horse, it's about 9 kilos of hay per day. We're talking about hays, we're talking about low sugar, so your lucerne hay, your Rhodes grass hay, or you can even soak the hay. I'll chat a little bit more about soaking in a second, but I think, Dave, you probably appreciate this too, right? Not everybody realises how much 4.5 kilo weighs just by eyeballing it. You really need to get some luggage scales and weigh the hay.
Yeah, nobody appreciates how little most horses need to eat, particularly with the pastures that they're often fed on. So yeah, if you don't weigh it, you'll cheat. You won't believe it.
A really easy thing to do is just to go down to the shops, get some luggage scales. Nobody's traveling anywhere anytime soon, so there's plenty of luggage scales around. Just weigh these hay nets and weigh them dry, and just determine how much hay to actually feed these horses over the course of the day. And you can get a lot of small little hay nets and feed them multiple feeds over the day, so they're always being trickle fed some sort of forage. If you are soaking hay, I know your cereal hays here, you probably don't have a lot of this over there. You don't have a lot of oaten or wheaten hay in the UK, I'm guessing. It's a pretty popular feed for horses over here. It's readily accessible to get. So a lot of horse owners do feed your cereal hays, and I think those hays tend to be upwards of 30% in sugars. So you really want to aim for, what is it, about 10, 12% in sugar in these diets?
Less than 10, yeah.
Less than 10.
Ideally.
So soaking these hays really important. And we had a few questions submitted about soaking and how long to soak for, and, you know, timing of soaking and things like that. So basically what I tell people is that the longer the better in a lot of cases. I know in summertime over here, there's a bit of a concern over any sort of moles or bacteria developing on the hay in the warm weather. But I think if you soak it, you can correct me if I'm wrong, Dave, but if you soak it and then feed it shortly after it's soaked, there shouldn't be an issue.
Yeah. Yeah. You just don't want to soak it and then leave it around for 12 hours.
Yeah, there's absolutely no need to drip dry or air dry the hay. Just soak it, pull it out and feed it to them. These little greedy ponies aren't going to mind if it's wet. The other thing, if you're only able to soak the hay for a short period of time, the volume of water you soak it in is really important. So the sugar diffuses out of the hay through a process of osmosis. So it's high concentration in the hay, low concentration in the water, and it will diffuse out of it. And there was a really good Beaver webinar on just last week about feeding laminitic horses. So I've stolen this from one of those slides that it basically says if you're going to soak for an hour, soak 1 biscuit of hay in 25 litres of water. So to leach out the most amount of sugars from that biscuit. I think it's important, and I probably should say this because people will yell at me in some parts of Australia that are on water restrictions, that, you know, use your water wisely. And if soaking hay, a lot of hay is tricky because you are on water restrictions, then, you know, you're probably going to have to find some low sugar alternatives like your Rhodes or your Lucerne for your horses. But each place is different. Each horse is going to be different. So those are just some general recommendations there that might help you guys. And one thing that soaking does as well is it's going to leach a lot of the essential amino acids and vitamins and minerals out of the hay. So I touched on earlier about feeding your horses a ration balancer, some sort of pellet. These guys usually really will eat anything because pellet's a bit of a treat for them. So you can use your ration balancer if you want to give your ponies treats, then weigh out your ration balancer pellet and give it to them as treats over the course of the day. Do you have anything else to add there about dietary management?
No, that sounds pretty good to me.
Okay. Should we chat a little bit about exercise and when some of these horses might be able to get out there and start moving around? That's something we always get asked.
Yeah. Clearly we want to get them back exercising as soon as we can. It's better for their physical and their mental well-being, and obviously it helps them to get weight off. Obviously, we said earlier on, do not move these horses when they're actively laminitic. So you've got to wait until they're sound and the structural changes in their feet have all settled down and their feet are strong enough to cope with the exercise. And that's something that you need to work with your vets on to decide, really. As you pointed out there, Tanya, you do this too soon and you're just going to undermine the hard work that you've done, and you're going to compromise the integrity of the feet and prolong the recovery. So better to be cautious rather than too aggressive in returning back to exercise.
And I think in the short term too, if people they want to encourage their horses to move around and they're not necessarily going out to ridden work, I think track systems that people have around their property where they can be out and interacting with other horses and still move around are really, really useful. Some of my clients one of my clients out in the wheat belt has just sent me this video of this amazing track system that she's made for her horses that around her property. It's a few kilometres long, just with some star pickets, and these horses are moving around in it, and you can see clearly that they're quite enjoying just being out trotting around, but these little fatties are being locked off the lush green grass just on the other side of that fence. So be creative. Like, you're really only limited in your creativity and what you can do on your property. But turnout in bush paddocks are also a really good idea. In lots of horse properties, you'll find some areas where there's just a lot of bush and there's not much pasture. So getting, these ponies sometimes quite like to go out, hang a few small hay nets up from different trees, and they can interact with their other friends and still get some movement. But in the early stages when you're doing this, I'll always encourage you to, if you're check for digital pulses. If you notice any sort of lameness, then bring them in and don't turn them out. And it's just going to be really case by case dependent. We can't really give you any set figures of every horse can be turned out for X amount of hours at this period after suffering a bout of laminitis. It's really case dependent. So work with your vets. My clients send me pictures all the times and videos all the time of their horses out and doing things. So I'm more than happy to chat to anyone about that later on. So I think
one thing to bear in mind with the track systems and bush paddocks and so forth is horses pottering about in those situations. It's great for their mental well-being, and there's no doubt it's a really great way to manage them, but it's not going to burn off huge numbers of calories. So if you're thinking about exercise for weight loss, those systems, they're gonna help, but they're not going to do enough. When we get past the phase of recovering from laminitis and we're looking at reducing weight to prevent recurrence, more exercise is going to be required than them pottering around in track systems. But there are still huge advantages to track systems in reducing their access to pasture and improving their mental well-being. They do need trotting, cantering exercise to really make a difference to their weight.
Yeah. So if we talk about some cases now that, and I mean, you talk about this a lot when we're chatting about cases that we're struggling with, that there's some horses where the owners are doing everything right. You know, they've got their diet right. They're doing everything they can to manage their weight, but we're still struggling with, their insulin levels. There is some sort of pretty new and exciting developments in the field of different medications that can be used. And you've been involved in probably a lot of them. So do you want to sort of a brief overview of some of those options?
Yeah, and I think we're never keen to use medications for management issues, but I think there's a growing appreciation that some of these ponies particularly are metabolically such that it's nigh on impossible to get their insulins down to a safe level and allow them a normal way of life, because their metabolism is just what it is. So I think we are all becoming more proactive about using medications to control their insulin levels in that subsection of patients. So it's no substitute for appropriate management and appropriate diet, but I think it is becoming something that we are turning to more and more. And if we look at the parallels in human medicine, they're a lot more proactive in using medications in metabolic syndrome to prevent the human health effects of our metabolic syndrome, which is quite similar to what we see in horses, albeit we don't end up with laminitis, we end up with heart disease and strokes and other things. But there is a move to being a lot more proactive with using drugs to control these insulin levels. We've used metformin. None of these drugs are registered for horses, I should say. There isn't anything registered in this area, so we're using human medicines essentially under the cascade, so we can prescribe them as long as there's a justification for doing so. We've used metformin for quite a while. I did some work on metformin when I was in Wagga quite a few years ago. Questionable how much difference metformin makes. Some people like it. A lot of us are a bit skeptical as to whether it makes a big difference in practice. We use a drug called levothyroxine, which is a thyroid hormone that helps to increase their metabolic rate to burn calories. That does work really well. People are slightly reticent to use it because they don't like the idea of giving a hormone, but it is exaggerating the horse's normal thyroid hormone levels. So that's really effective in weight loss. The more recent thing that we've been working on, I know you've been working on, Tanya, are the SGLT2 inhibitors, which promote glucose excretion from the kidney and therefore help to control insulin levels. And they're probably the most exciting development. They do appear to be really, really effective in lowering insulin levels and assisting recovery from laminitis. And we think they probably will also help in the prevention of laminitis. So that is a really exciting development. It's still early days. We still need more data. We need to treat more cases, but they have the potential to be a bit of a game changer.
Yeah, definitely. I think it's something that, like you said, people are pretty hesitant to reach for medications. But if we're talking about, improving the welfare of these animals, and we're not able to make much headway with diet and exercise, I think we absolutely should be doing everything we can to get them back and happy, healthy, and not lame, right?
Yeah, 100%.
Yeah. I know we've got some vets and some vet students that are probably going to be watching this. Dave, you're doing a webinar on laminitis, I believe, on the Bovis Scholars page towards the end of September. So we probably give that a bit of a plug for any vet students.
Thank you.
Shameless plug for you. And yeah, so they can tune in there, and I'm pretty sure you'll be talking about these medications in a bit more detail and some of the work that me and you have been doing on them.
Yeah. Yeah.
Okay. So really, before we just delve into a few of the questions that we've got that were submitted, I think we just really want to emphasize that laminitis is an emergency, regardless of the spectrum of lameness your horse is showing. Get your vets involved early, confine your horses, get them off any sort of high sugar hay, or get them off pasture at the earliest signs that you notice your horse being laminitic. As Dave said multiple times, that majority of these laminitis cases are due to high insulin levels, and it's managing their insulin levels through diet and controlling their obesity is absolutely preventable. And we need to be pretty proactive in doing that in order to get a good response for these guys. So have you got anything else there you wanted to add before we jump in the questions?
Oh, no, just to reiterate how serious a condition it is and how infuriating it is when people consider it a normal part of being a horse or pony. Like the level of suffering is horrendous. So we've just got to break that complacency around laminitis.
Yeah.
It's one of the biggest killers of older. I'm not aware of study data in Oz specifically, but it's been studies done in the UK, and it's one of the biggest causes of euthanasia, particularly in the older horse population. And it's just so eminently preventable. Just got to get that message out there.
Yeah. So this was submitted. The question is, my horse is skinny but still gets laminitis. What can I feed him that will be safe? Yes, Dave, you alluded to this a little bit about the lean EMS horses too, right?
Yeah.
I think diet-wise, I think is, I can answer that, and you can talk maybe a bit more about the testing and diagnosis side of things. But diet-wise, I still think they need low sugar feeds. If they need to put on weight, you can provide calories, in the forms of unmolasses beet pulp. It's a good way of adding calories in, using some linseed oil, lucerne, soybean meal are all good ways of, ensuring they get good quality protein as well. Multiple small feeds a day is useful. Checking that they don't have any other underlying disease, so dental disease or parasitism is important. Is there anything else you can think of for that?
Yeah, I think you're right. You're unlucky if you have got one of these native types that you've got the weight off and is still getting laminitis. Most of the problems we have are with horses that are obviously overweight, but some of them do really hang on to these internal fat deposits that are very metabolically active. So some of them, once they've got really fat, are still a problem even once you've got the weight off them. Everything you've said is obviously spot on. These are some of the horses where some of the insulin sensitizing drugs to lower insulin levels are really quite helpful. So etagliflozin is the one, that the SGLT2 inhibitor that we've been using more recently. So if you're doing all these management things and their insulin levels are still really high in response to their diet, then you may need to be considering some kind of treatment to limit their insulin levels. But hopefully you can manage with just diet and exercise alone.
Okay. Got another question here about, says, my 15-year-old Arab has been on and off laminitic for approximately 2 years, tested positive for Cushing's, and has been on pergolide, but still suffers recurrent bouts of laminitis. How can I manage him? Do you want to take that one?
I'd be really curious to know his insulin levels. I think the awareness of PPID or Cushing's has really increased a lot recently, and that's really fantastic. But I think there can be a danger that we focus on the management of the PPID and the ACTH concentrations, and we overlook the metabolic changes that might also be there. So high insulin levels that lead on to laminitis. So important to make sure the PPID is under good control. Just because he's on treatment doesn't necessarily mean he's under good control. And beyond that, to be looking at insulin levels, looking at diet, and do all the things that we've been talking about for reducing the risk of laminitis through management of metabolic syndrome.
I think what you said's really good there, because I think we need to kind of separate the two, right? Rather than lumping it all into PPID or all into EMS. It's insulin's really the main driver for laminitis, and that's really what we need to focus on. And we're not going to ignore their PPID, because we know that there's, good welfare implications for treating them with pergolide. But if you have a horse that's intermittently laminitic despite treating them with pergolide, then we really need to focus on their insulin concentrations.
Yeah, giving them a pergolide tablet is not enough and doesn't always get to the root of the problem.
Yeah. So this is a question I get all the time, and you probably do as well, is when is it safe to turn my horse with EMS back out onto pasture, and will they ever be able to return to grazing?
Well, you obviously hope they can return to grazing. There are some that really will always struggle, and again, this is where some of the medications come into their own. Bottom line, there's no rules. You just need to know what their insulin responses are to the pasture, and obviously that can change with different pasture conditions, different weather, different levels of rainfall. The only way you're really going to know if it's safe is to put the horse on pasture for a short period of time and to check its insulin levels, which is what you were describing you do for your horses earlier on. That's the best way, really.
I think even things, depending on the time, I wouldn't recommend someone just turn their horse out to pasture for 12 hours. I think gradually increasing it, and like Dave said, measure their insulin levels so we know what the safe timing is for them to be turned out onto pasture. Early in the mornings, the sugar content of most grasses tend to be a bit lower too. Obviously not after a hard frost, but those are all individual little nuances that we can chat to you guys about later. If you've got any questions, just send me a PM on Facebook and we'll try to get to it too. Okay, so this next question, this is another one that we get fairly often. My horse was diagnosed with gastric ulcers and my vet said he needs to be turned out onto pasture, but he gets laminitis on grass. How do I manage him? I think if I had to pick between managing their gastric disease or preventing laminitis, I will 100% pick preventing laminitis. I don't know. What do you reckon?
Yeah, more than 100%. Horses don't die of gastric ulcers, so they do die of laminitis. So yeah, focus on the laminitis. So I think, again, the same things about knowing the level of risk turning out to pasture still apply. So if we can establish what the level of risk for laminitis is on pasture, that's really helpful. And then for managing the gastric disease, that's another webinar in itself, but it's just a case of trying to trickle feed fiber through the day and allow normal behavior. So the more you can do that, the better. It doesn't necessarily mean the horse has got to be out on green grass all day. So it's finding that balance of all the things that we've discussed. And I think really revert to your vet probably and discuss your concerns, but always focus on the laminitis over the gastric disease.
Yeah, 100%. All right, this is definitely a question I'm handballing to you. What supplements can I use to prevent laminitis?
Depends how much money you want to burn. The evidence for supplements and laminitis is scant and non-existent. Personally, I wouldn't use any because there isn't any evidence to support the fact they make a difference. I have a real issue with some of the antibiotic supplements that are used to prevent laminitis. They've actually been banned in the UK and in other parts of the world because it's such an irresponsible use of antibiotics. And there isn't really credible evidence that they make a difference in the kind of laminitis that we're dealing with day in, day out. So to be giving antibiotics, I just think is scandalous. So please don't do that. Beyond that, there are different elements and nutraceuticals that have been advocated, but there isn't the evidence to support their use, and often they're really expensive. So I would save your money. Feed a good quality low sugar diet, feed a good quality vitamin and mineral balancer. Otherwise I wouldn't go there. But am I being unfair? Am I being too cynical?
No, that's pretty much what I would say to people. And if you're gonna invest money in something, I would strongly recommend you invest your money in insulin testing, right? And working out your horse's laminitis risk, rather than wasting money on different supplements that claim things and really aren't based on any credible science.
Well, and making management changes, setting up areas at home where they can go out safely and express normal behavior, but aren't going to be exposed to too much in the way of lush pasture. Like, those things cost money. The fencing, the wood chip, or whatever you're going to put down, all those things that you need to do, that costs money. Far better than pointless supplements.
Yeah. Okay, so I think we may have covered some of this previously during the webinar, but I'll read it out anyways. My horse is on a low sugar feed, but he still is fat and gets laminitis. We can't shift the weight no matter what we do. His insulin is tested regularly, but is still high, even though his diet has been managed well, and he does not go out on grass. How do I manage him? So I think this typically might be
yeah. Well, the first thing I would say is, if you feed a horse little enough, it will lose weight. So it might be that you're actually feeding it more than it needs. So I would review exactly how much you're feeding. Even low sugar feeds, if you feed enough of them, the horse is still going to maintain weight or gain weight. So I would scrutinize exactly how much you are feeding and weigh it really carefully, and make sure that the horse is only getting what it's supposed to get. There does come a point, though, where it becomes risky to reduce the diet any further because of concerns over gastrointestinal health and the horse's mental well-being. So if you have genuinely got to that point that you can't reduce its diet any further, then you are then thinking about using some of the drugs that we discussed earlier to limit insulin concentrations, and that one that levothyroxine potentially would be helpful to try and get the weight off. That's probably the most useful at shifting weight. But if you've gone down that route and shifted the weight that you can, then you're probably looking at etagliflozin, the SGLT2 inhibitor, to try and limit those insulin levels around feeding. But first thing I would do would be scrutinize exactly how much you are feeding.
Yeah, definitely. And weigh, like we said before, really important to feed by weight and not by volume. So I think that Dave's raised a really good point. Just look at that diet first and foremost before we go down the path of any sort of pharmaceuticals. And this question could be a whole webinar on its own about, because one of the later questions that got submitted is, why is obesity such a common issue amongst horses and ponies nowadays?
Because we feed them too much. We feed them too much. They were native ponies, particularly, or native types of horse that lived on really poor quality grazing in the UK, on the mountains and the Shetland Isles. Really low nutrition. When they were domesticated, they were expected to work really hard. Now we put them on cultivated pastures. I'm no expert on your pastures, but in the UK, lots of ryegrass that was designed for animal production, that's got a really high sugar content. It's nothing like the mixed native forages that they were grazing naturally. And largely, we don't expect them to do any work. We just give them a pat and a brush twice a day, so they don't do any exercise. So I'm afraid it's our fault for the way we manage them, which is why we really do need to overhaul how we feed and manage particularly native types of horse and pony.
And I think the perception of what's an ideal weight has also shifted, hasn't it? And if you look at what people thought was a normal weight for a Welsh pony 10, 15 years ago even, it's dramatically shifted to what it is today.
Yeah, it absolutely has, because we manage them differently, and every horse that you look at is managed in that way almost. They all carry a lot more weight than they used to when they were working and they were fed less. So yeah, 100%. We expect them to look fat now, and we think that is normal when actually it's overweight. Okay,
well, I think that's a good spot to end. Dave, you might have to come back and do a few more webinars expand on some of these other things. If we can twist your arm.
I'd rather come to WA if that's all right.
You come to WA and we'll record some in person.
All right.
Okay, well, thanks very much for your time. I really appreciate it.
No worries.
Thanks everyone for tuning in.